Good morning to everyone. At the outset, I want to thank AIO Scientific Committee and Dr. Malik sir for the opportunity. So today, my presentation will be on corneal closing cross-linking and how it is performed, regarding the basics and how to proceed with it. So now, as we are clear about the indications of cross-linking by my previous speaker, we also need to document the data correctly whenever the patient presents to us in the OPD. It's important to document refraction, uh, uncorrected and best corrected visual acuity, topography, and with a good acquisition quality and a central column thickness. This is important because, as we all know, that keratoconus is a progressive corneal ectasia, and to document the progression, the initial capture of the data is very important, which would help to determine the progression and help in deciding whether to go for a cross-linking or not. Now, the various clinical considerations that we need to keep in mind are age, that is patient presenting in first and second decade of life. We need to go for cross-linking as the patient is being diagnosed. In the third decade, we can wait for progression to happen and then document the progression, and then maybe we can go for cross-linking. We should also look clinically for associated allergies, any active VKC or atopic allergy, associated syndromes like collagen vascular diseases or Down syndromes, and associated autoimmune history, like a patient with an autoimmune history is better contraindicated for cross-linking. Special considerations like pregnancy and lactation, we avoid cross-linking in that stage. And also presence of pre-existing corneal scarring and a history of prior corneal surgery. We need to go and just customize the treatment accordingly. Most important, as we all know, that the patients in this age group, in which the keratoconus presents, are usually in the economically productive age group, and the most important thing for them is counseling. And there might be children who would be accompanying with their parents, and the counseling plays a vital role in deciding and making sure that what are we going to do with the cross-linking and how the cross-linking is supposed to proceed. So the patient should be very clear about the aim of cross-linking, that it's being done to strengthen the cornea and not to improve vision, or not to sometimes the patient asks that whether I would be free of spectacles, something like that. So we should be very clear that it's not going to be like that. We should be clear about the expectations of the procedure. We should also be clear about the patient should also be clear about the course of recovery. How long is it going to take for the person to resume his day-to-day activities? And also, the most important for which the patient has come to you is visual rehabilitation. So the patient should be clear that when are you going to give contact lenses or RGP or glasses, or proceed for eye seal in such patients. So coming to pre-op preparation, it's important to prepare the patient a day prior. Instilling antibiotic drops a day prior, 0.5% moxifloxacin 3 to 4 times a day is sufficient enough. Asking the patient to have a head bath, because the next 5 days he's not supposed to have, because he will be having contact lens, and that there might be chance of extrusion of contact lens. Avoid eye makeup on the day of procedure, and avoid use of any contact lenses on the day of procedure. So this is a C3R machine prototype, and as we can see that this is a display console of the machine, and this is the light emitting UV emitting arm of the machine. It has got a foot pedal, so that you can adjust this UV emitting arm to focus it on the cornea. As in your right, we can see that the parameters which shows is a treatment power, the power at which we want to deliver UVA. The amount of time for which we want to irradiate the cornea, it may be varying depending on the protocol, what we are going for, and then the total amount of energy that we aim to deliver to that particular cornea. Usually it is 5.4 joules per centimeter square according to the resident protocol. Now here is a short video just to demonstrate that how do we adjust various parameters before starting before taking a patient for cross-linking. So this is a minutes through which we can adjust the minutes, and according to protocol we can adjust the power according to protocol. Now the machine also has got this UVA emitting uh, arm, and it has got two red dots, and these two red dots need to coincide, uh, and that is the endpoint of the focus of the UVA over the cornea. So we can move this UV emitting arm up and down with the help of the pedal, and this makes the endpoint at which we should irradiate the cornea with UVA. Now coming to the Dresden Protocol, uh, uh, Gregor Wallenstein and Sperl in 1998 proposed a protocol in which 23 eyes of 22 patients were cross-linked at University of Dresden, and it is a AP-off protocol in which there are three stages: epithelium debridement, followed by soaking, and followed by irradiation. Uh, the most important thing we need to understand that cross-linking is a sterile procedure, and painting and draping plays a vital role in it. Uh, Lashes coming in the view of in the surgical field can be a nidus for infection, and also if there are more lashes, it might hinder the cross-linking as well. The procedure is performed under topical anesthesia. Now, coming to the epithelial debridement, there are two ways in which epithelium can be debrided. Either it can be alcohol-assisted, or it can be mechanical debridement. Now, this is a short video of how alcohol-assisted debridement, how to perform a alcohol-assisted debridement. Absolute alcohol can be poured in this 9 mm well, and we have to wait for 30 seconds, and post that we can use Merocil to sponge to absorb the excess of absolute alcohol, and we give a thorough wash of 10 cc saline, and then use a dry Merocil sponge to just peel off the surface epithelium. It comes out mostly in toto, and gives a very good exposure of underlying stroma. Now, other option of mechanical debridement is epithelial debridement is a mechanical way. So the most commonly used instruments are either Tukes knife or a hockey knife for epithelial debridement. And this is a short video which shows how we can debride it in a effective manner. So we can use a blunt refine or a 9 mm corneal template to create a mark, and this mark can be adjusted according to according where you have got a cone, and maybe you can recenter it inferiorly or superiorly, how you want to proceed. Then we have to disrupt the peripheral epithelium, and then can keep proceeding further ahead. The care is taken that at all time your spatula is striking at a 45 to 60 degree, not 90 degree exactly with the stroma. Otherwise, it can cause damage to the Bowman's, as the Bowman's in keratoconus patients is quite thick and is quite thin and fragmented, and if it is injured, then it can lead to a underlying stromal scarring as well, and an irregular astigmatism as well. So now we can flush with a saline and just scrape the remaining stuck epithelial cells over the cornea to get a good exposure of the underlying stroma. Now coming to the soaking phase, in this we soak the cornea for 30 minutes, and we put riboflavin 0.1% every 3 minutes for 30 minutes, so that the riboflavin can percolate inside in the stroma. And riboflavin, as we know, acts as a photosensitizer and increases the UV absorption by the cornea. After this phase comes the irradiation phase. Now during irradiation phase, we have to focus this UV arm over the cornea, and this is a short video in which we can see that the two red dots are being focused at the corneal plane, which marks the endpoint of UVA focus. And now we can start with the UVA irradiation following that. So irradiation of the power of in Dresden, the power of 3 milliwatt per centimeter square for 30 minutes is delivered, and the UVA source is 370 nanometer. The total energy delivered is 5.4 joules per centimeter, and in between we need to instill riboflavin intermittently every 3 minutes to keep the to keep the cross-linking on, and also we need to wet the cornea with BSS to avoid drying. So at the end of procedure, uh, flush the surface with good amount of BSS. Use bud to absorb any extra amount of riboflavin. Put antibiotic drops and place a bandage contact lens, which would help to reepithelize the cornea in the further post-op management. So now the post-op management of cross-linking has got three prongs. The first is pain relief, second is inflammation control, and the third is reepithelialization. So pain can be to control the pain. Any painkillers, paracetamol or a combination of paracetamol with aceclofenac can be given to the patients. Uh, Inflammation need to be controlled using a topical antibiotic and a steroid combination. Usually a surface steroid is sufficient enough, like a loteprednisolone with a combination of tobramycin 4 to 5 times a day in the initial week is sufficient for controlling the surface inflammation. To replenish the cornea, we need to give copious lubricants, either in the form of either containing 0.5 CMC or sodium hyaluronate based lubricants. Thus, the take-home message is to capture the data properly at the initial stage when the patient presents to the OPD, adequate counseling to elevate the anxiety of the patient regarding C3R and its complications, ruling out other contraindications, and taking care of sterility are the key for optimal outcome in C3R. Thank you. If anyone has any questions, meanwhile the presenter is being getting ready, we can go for that. So next, I would, yeah, yeah, please, please, sir.
It takes away a lot of doubts because
Yeah.
you presented very well. Can you recommend any book which we can purchase to, because you have to reinforce yourself before you start doing this procedure? Any good textbook you would recommend for C3Rs? Keratoconus?
Recent updates on colonial cross-linking. There is a book. I think I'll personally let you know. It's a Springer publication. So I'll just let you know about that. And it's a good, excellent book, starting from the basics and covering the recent advances as well. So I think that would be.
What's the name of the book?
Recent advances in cross-linking.
Thank you.